Okay, this is chapter 10b from the book Medical Reformation by me. So we're going to talk now about the endothelial cells. Okay, the name of this chapter overall was hypertension, atherosclerosis, and heart disease. So the endothelial cell does a lot of stuff to prevent blood clots from forming on it. First of all, and most importantly, it releases nitric oxide, NO, nitric oxide. It's a gas. It diffuses into the lumina of the artery, and it interacts with the platelets to prevent them from clotting. There's also something, this PGI2, a prostacyclin, that also prevents platelets from clotting. In addition, the nitric oxide gas diffuses into the arterial wall to the smooth muscles, and it inhibits them from contracting, so they vasodilate. It's a vasodilator. Okay. Additional things that prevent clots from forming on the endothelial cell surface is that it has its own zeta potential. It also has a glycocalyx, sugar coating, attached to its plasma membrane, things like heparin sulfate, sialic acids, cholesterol sulfates, and negative charges. Zeta potential is made up by negative charges. Red blood cells have a negative charge, so red blood cells, they repel each other, kind of like bumper cars. They don't want to stick together. They've also released TPA, tissue plasminogen activator. That's also a clot dissolver. They also have attached to the heparin sulfates, they have antithrombin 3, another thing that prevents clotting. So a lot of stuff is happening on the endothelial surface to prevent clotting. You don't want clots, because most common cause of death in the United States is a heart attack, all right? And that's from a blood clot forming in the arteries of the heart. And what I'm trying to say is most people die because of a blood clot. All right, when they have a stroke, that's because of blood clotting in the arteries of their brain. Okay, and even you talk about cancer. The main cause of cancer is the Warburg effect. Warburg effect, you can pronounce it. And what that means is tissue hypoxia, lack of oxygen in the tissue. Well, why does a cell have lack of oxygen delivery? Because there's atherosclerosis, blood clots in the artery that are feeding into it as the major cause of it. And simultaneously, there's hypoxia due to fat sticking the red blood cells together, dropping their oxygen delivery, let's say about 20%. Vasoconstriction from sodium, decreasing the diameter of the arteries feeding that tissue. So what I'm saying is this idea of decreased blood flow and blood clotting, it's the main thing killing people. Okay, so you don't want this happening. All right. The most important thing to know, if you only know one thing about the endothelial cells, the arterial lining cells called endothelial cells, and endo means inside, so they're inside the lumen of the artery. The most important thing is that it makes nitric oxide. Okay, and I went to Dr. Esselstyn's training course. As a doctor, I got to go for free. And he's lecturing, all these patients and people in the audience. It's a one-day course, all-day long course. And he keeps going, this nitric oxide, nitric oxide, this and that, on and on about nitric oxide. So, I'd raise my hand and go, what about this? What about this? He goes, I'll talk to you later. And then he came up and he spoke with me later when we had free time at lunch. And he goes, Pete, the most important thing is the audience has to understand nitric oxide. If they understand nitric oxide, he says, they will be successful. If they don't understand nitric oxide, they won't be successful. If you give them all this detail, you just confuse them, and we won't accomplish anything. And I thought it was kind of funny, because that, by the way, is the classic stereotype of a surgeon. Just wants to know what he needs to do to get the job done, doesn't care about the details. Okay, obviously Esselstyn's a brilliant guy. He's another guy who deserves a Nobel Prize for his work, but he'll never get it. There's no way. Conventional medicine, big pharma, they don't want anybody to know about Esselstyn, that somebody could cure coronary artery disease on their own rather than spend tons of money on all their drugs and tons of money on stents and open heart surgery. Are you crazy? They're going to suppress that knowledge as best they possibly can. Okay, so a little bit more to know about endothelial cells. They are spindle-shaped, and their long axis, they're aligned with their long axis being parallel to the long axis of blood flow. So they have little like hair-like extensions on their glycocalyx. They can sense the direction of blood flow and that it's laminar. That's what they expect. That's what they like. That makes them happy. So they're spindle-shaped, orientated along the direction of blood flow. Their long axis is. Okay, now red blood cells typically have a life of about 120 days, which is about 3 months, okay? They're cleared by the spleen. And the way it works is the more time goes by, the stiffer the red blood cell gets. So normally it has to deform itself to fold back on itself. Like I was saying, let's say it kind of comes in like this, and it has to fold back on itself in order to fit through that capillary, because the RBC is 7 microns, capillary is only 5 microns. And the longer it's around, the stiffer the red blood cell gets, because its outer surface becomes more glycated, like hemoglobin A1C measurements, sugars attaching to the proteins and making them stiff. In addition, you get something called externalization. So what that means is you'll have a phosphatidylserine phospholipid on the plasma membrane. Let's see if I can show you. Is there a way I can show you? Okay, here it is. So imagine here's its head group on the inner leaflet of the plasma membrane of the red blood cell. The older that red blood cell gets, the more the phosphatidylserine flips to the outer leaflet of the plasma membrane of the red blood cells. And that is associated with stiffening of the red blood cell. So that's called phosphatidylserine externalization. And the stiffer the red blood cell gets, the more trouble it has passing through the spleen. Inside the spleen, you've got these smaller capillaries. They're only about 3 microns in diameter. Remember again, red blood cells are 7 microns. Normal capillaries in the body are about 5 microns, and spleen has capillaries that are only 3 microns. So that's for the blood that goes through the sinusoids. And when they go through those 3 millimeter capillaries, it's like doing the limbo. And if that's a stiff old RBC, it can't make it. And it's then cleared out by the macrophages in the spleen. The reticuloendothelial cells are typically called. So anyways, reticuloendothelial system. You see it a lot of times abbreviated RES. So the spleen is basically the graveyard for red blood cells. And it's usually going to be, they're cleared out when they're about 120 days old, so 3 months old. Okay, that's relevant to know. And there's weird situations where if you get enlarged spleen, splenomegaly that's called, a big spleen, it can sometimes remove too many red blood cells. It can sometimes remove too many platelets. It can cause problems. Okay, we won't get into that anymore at this point. Let's see here. Okay, this was that concept I just talked about with phosphatidylserine externalization. So here's phosphatidylserine. It's the red ones. The phospholipid head is the polar part with a phosphate on it. The tail's going back into the center of the plasma membrane. Those are hydrophobic, just being lipid, just carbons and hydrogens. Polar means that something is soluble in water. Hydrophobic means it's not soluble in water. Okay, so the inner part of a phospholipid bilayer, it's called a bilayer because there's 2 parts to it. There's an inner leaflet facing the cytoplasm and an outer leaflet facing the extracellular matrix. So what happens over time in the red blood cell, its outer membrane of a cell is called the plasma membrane because it's in contact, let's say, with the plasma of the red blood cell. Okay, its outer leaflet will then flip to the extracellular side, the outer face, if you will, outer leaflet of the plasma membrane of the red blood cell. And as this occurs, the red blood cell becomes stiffer. So that's called phosphatidylserine externalization. Oh, so here's then comes a big question. Why is it that eating a high-fat diet also causes insulin resistance, leading to hyperglycemia, leading to more glycation of the red blood cells? So it accelerates the rate at which they become stiffened. Why do women live longer than men? Because they menstruate. So the woman might think, oh, menstruating is annoying, what a nuisance. But in reality, it keeps them alive longer, especially in Western countries. Because when they're menstruating, it's basically like a therapeutic phlebotomy every month. I don't know if I remember, I mentioned to you that Dr. Sloop will donate blood periodically to lower his hematocrit. Okay. So anyways, when you lower the hematocrit, the blood is thinner, less thick, lower viscosity, so that lowers blood pressure. Lower blood pressure means less injury to arterial walls, and that means less atherosclerosis. Okay, so that protects women. Once a woman's postmenopausal, they start taking on similar risks of a man of having these progressive Western diseases. If a woman has a hysterectomy at a young age, and they often get hysterectomies due to fibroid tumors of the uterus, fireballs in the Eucharist. Okay, so anyways, and that's for multiple reasons. They're exposed to so many estrogenic chemicals in Western society that these women who get a hysterectomy at a young age, they often have terrible hypertension, and they're not aware of it. Like a guy, he's scared about atherosclerosis and hypertension because he's seen his buddies going impotent in their 30s and 40s and 50s. So he's, checking out his cholesterol, trying to get his act together. Whereas a lot of times the woman will be relatively oblivious because premenopausal women, they don't tend to have problems with hypertension, atherosclerosis, and whatnot. But this is how it can catch up with them. Mayo Clinic did a series of about 2,000 patients with hysterectomies before the age of 35, and they had a lot more problems with coronary artery disease, congestive heart failure. They also have increased dementia and other problems because they've got a bunch of hypertension. Hypertension is a major risk factor for intracranial small strokes and atherosclerosis. Okay. Because some people try to say, oh, is it estrogen that makes them live longer? No, it's not the estrogen. It's the menstruation. Okay, here is a picture of an endothelial cell glycocalyx. And there's a couple things a little bit interesting about it. I'm trying to shrink myself a little here. Okay, so here's your endothelial cell plasma membrane facing the plasma of the blood. The plasma runs right along it. And here is the core protein. And then attached to the core protein are these glycosaminoglycans. All right, and they're going to have repeating, disaccharide units of sugars, and they're going to have sulfates attached to them. Okay, for example, heparin sulfate. And these negative charges create a zeta potential on the surface of the endothelial cells. Okay, so this negative potential is what repels the RBC when the RBC comes floating by. And the sialic acids also have a negative charge, which also contributes to the zeta potential. The sialic acids are also important as part of the immune recognition component of the of individual cells. So sort of like an identity card, if you will. Yes, this belongs to your same body. Okay, and it is human. Okay, so anyways, water will come by, and water will interact with the glycocalyx. Water has a dipole, meaning that it has a charge on it. It's not a full charge, it's a partial charge, but the oxygen pulls electrons toward it, so it has a slightly negative charge to it. The hydrogens have a slight positive charge to them. So the slight positive charge of the water interacts with the negative charge of the sulfates on the glycocalyx. And the net result, the way you can think of this is it's slippery, slippery when wet. So the water's attraction to it kind of keeps the glycocalyx a little wet. And think about it. This is brilliant. There's lots of things like this in the human body. It's like genius design. So by having water attracted to it, this makes the glycocalyx very slippery. So it facilitates the red blood cells and the white blood cells sliding right over. It's exactly what you would want. Look at all the negative charge on the sulfate there. Okay, and white blood cells is even harder for them to get through a capillary because they're bigger. They tend on average to be about twice the size of a red blood cell. So you can imagine getting something that's in the ballpark, 10 to 14 microns, passing that through a capillary. It really has to deform a lot. So having this be nice and slippery with the repelling zeta potential, that's exactly what you would want. And the glycocalyx sticks up from the endothelial cells. They kind of look like what a little trees would look like on top of a hill. Okay. And glycocalyx is made out of proteins and sugar. So protein is proteo, glyco, sugar is glyco. So proteoglycan is the name of the proteins that are sort of like the core protein for the attachment of all the sugar residues, the disaccharides of the glycocalyx. Okay. So usually I would abbreviate it EC for endothelial cell glycocalyx. Sometimes I'll even abbreviate it ECGC. Okay. And the polymer of sugar molecules attached to it are called glycosaminoglycans. You don't necessarily need to know all of this vocabulary, but just so you've heard it once and just remember it's associated with glycocalyx, that's good. The purpose of the zeta potential is so things don't stick together. We talked about all this stuff. Yeah, and the people who eat healthy diets, they have this usually same blood pressure as childhood. They have it all their life. Or if it goes up, it only goes up a little bit in adulthood and later adulthood. Okay, so now I'm going to show you a slide. This is what cartilage looks like. So cartilage is in your joints. And the point I'm making here is it's very similar to the endothelial glycocalyx. You'll have in the middle something called hyaluronic acid, and you'll have the core proteins attached to it. And then you'll have the negatively charged disaccharide repeating units with sulfates on them. Like this one will be chondroitin sulfate. Okay, chondroitin kind of like implies cartilage. And basically you get the same water interacting with them, and that makes the surfaces slippery, which is what you want inside your joint. Okay, and the fact that water is attached to it too, that contributes to giving it a little bit of a shock absorber effect. So imagine you're walking downstairs rather quickly. your joints have to absorb that shock, let's say your ankle and your knee, and this cartilage material helps to make that possible. Okay, now we're going to talk a little bit about the plasma membrane sodium potassium ATPase. And this is super important. What we need to know about it's relatively straightforward. So I drew this actually, that's the resting membrane potential of a neuron, but here's the point. The potassium sodium ATPase pumps out more positive charge than is brought into the cell. So I wrote it as Kn, as in K is for potassium. K comes from kalium, the Latin word for potassium. N comes from natrium, the Latin word for sodium. Okay, so 2 K pluses are pumped in, and 3 K plus and 3 Na pluses are pumped out. So 3 positive charges pumped out, 2 positive charges pumped in. So it leads to a net negative inner voltage inside the cell cytoplasm, and that's what you want, because you're really creating a battery here, whereby there's an electrochemical gradient. So electrical gradient because it's more negatively charged inside the cell. There's also a chemical gradient because the sodium tends to be 10 times higher in concentration outside the cell than inside the cell. And then coupled to that gradient, like the energy of a battery, it's used for pumping calciums. So the calciums are pumped out, and you do that by allowing some sodium to come into the cell. And the reason it all works is because there's far more of these guys, the potassium sodium ATPase pumps, than there are of these guys, like NACA exchangers. NACA is Na for sodium, Ca for calcium, X is exchanger. Okay? And so this is how cells do work. They create a battery, electrical power, across their plasma membranes by generating these electrochemical gradients with these potassium sodium ATPase pumps. Also, by the way, magnesium is needed to keep the phosphates all attached on ATP. ATP is adenosine triphosphate. And so the outer phosphates, they really want to pop apart because they're both negatively charged, but the magnesium with its positive charge hangs on to that extra phosphate until it's ready to be released by this pump enzyme reaction. Okay, but the point of all this is you want to eat your plants, because from your plants you get the magnesium and the potassium, and you need these guys to maintain these pumps and generate the electrical potentials, the battery energy of a cell. Okay, but what the typical American is doing, they're eating tons of sodium, far more than they should. Normally our ancestors probably ate in the ballpark 20-25 times more potassium than sodium, whereas we sort of flipped the ratio. The modern persons are pretty routinely eating 10 or 15 to 1 sodium relative to potassium. And that then will cause problems with these pumps. That'll lead to a gradual, progressive accumulation of sodium in the cell rather than the potassium that you would want in there. And it dissipates the gradient. It weakens the gradient. It makes the cells less able to function, sort of weakens them. Also, the body has to maintain sort of relatively exact concentrations of positively charged ions. Those are called cations. Cation is a positively charged ion. A negatively charged ion is an anion. Okay, so anyways, it has to balance its cations, because if the body were to have too much of one or the other, it would then lead to cell swelling. Let's say you had too many ions inside the cell. It would become hyperosmolar, meaning it would pull water into the cell and the cell would burst. You can't have that. Everything has to all be balanced. And so what I'm saying is, as you accumulate more sodium inside the cell, outside the cell, you're going to urinate out your extra potassium. So you're going to have potassium wasting. You don't want that. That's bad. Okay, so basically, how do you fix the problem? Like you fix most problems. Eat more plant foods, because then you'll get a lot more potassium, what you want. Don't eat processed foods. Don't eat meat with a lot of salt on it, because then you'll go in the wrong direction. Okay, neurons use about from half to 2/3 of their energy to run that potassium sodium pump. So it's super important. There's no way a cell would use that much energy. Sorry, I'm blocking the words. There's no way a cell would use that much energy for something unless it was super important. Okay, and it is, because it's the whole battery energy system of the cell membrane, and it uses that to take in good stuff, like take food in, and to pump out its waste product. Okay. We're designed to run on a high potassium diet, low sodium diet. Okay, this, by the way, is the greatest book ever written on blood pressure. Richard Moore is the name of the author. He's an MD, PhD physician scientist who devoted his life to studying. It's an absolutely brilliant book. It's one of my favorite medical books I've ever written. And he talks about what I just explained to you. He explains it in more detail. But what I gave you is the main point, what you need to know. He says that as long as a person eats at least 5 times more potassium than sodium, their blood pressure will probably be okay. But it depends how you defend okay. I'd like to say, at least 10 times more. All right. Like I said, our answer is probably at about 25 times more. P for potassium, P for plants. That's where potassium primarily comes from. If you look at the nutrient labels on a food, you'll see a lot of plant foods will have 100 times more potassium than sodium. Okay, where does magnesium come from? Magnesium's located right in the center of chlorophyll. You'll see a magnesium molecule sitting in there. So that's why plants are like perfect. They give you the nitrates, precursor for nitric oxide, vasodilator. They give you the potassium and the magnesium that function as like vasodilators. Okay, so that keeps your arteries open. Okay. You have to be careful though. If somebody has severe kidney failure, they might have a difficulty with ingesting larger amounts of potassium. They can't adequately excrete it, so it can be a problem in them. But for most other people, it's not a problem. Okay. That's something somebody have to work out with their doctor, okay, if they have a kidney problem. Okay, here's what I was mentioning about the magnesium. So here's an ATP. ATP is the main energy used by a cell to perform work. And ATP is adenosine triphosphate, 1, 2, 3 phosphates, triphosphate. And it's got these big negative charges on here. The magnesium holds them in check so this phosphate doesn't pop away until the right moment. So magnesium stabilizes the ATPs with its double positive charge. And then here's what I meant by magnesium having its location in food, in the center of chlorophyll. So you eat your plants, you'll get it. Oh, that's kind of what I mean. Is like the vegan diet is just so powerful. And you say, well, why is it so powerful? The reason it's so powerful is this is what we're designed to eat. And I said it's like the car metaphor. If you were... Let's say you bought a brand new sports car and you wanted it to run well. And the owner's manual, the dealer who sold it to you says you got to put premium fuel into it. If you have a brain in your head, you're going to put premium fuel into it. Okay, of course you're going to do that. All right, well, for a human being, premium fuel is the low-fat, low-sodium vegan diet. All right, now... The other thing, too, about it is, sports car, you hope the thing lasts you 20 years, all right? Your body, you want it to last you 90 or more years if possible. So can you imagine if you don't put premium gas into your sports car? Let's say you put regular and it's made for premium gas. You're going to screw up the car in all kinds of sort of random, unpredictable ways. That would be stupid. Okay, well, that's the same thing when you put, high-fat, high-sodium processed food into your body. You just kind of get all these random problems all over the place that generate the pattern of Western chronic diseases. And it's not like just a few people get it. I can tell you, as soon as you say the word, let's say you just told me, 65-year-old patient, I would know the patient almost always. I wouldn't even look at the chart. I would expect the patient to be overweight, pre-diabetic or diabetic. I would expect them to be hypertensive. I would expect them to have coronary artery disease. I would expect them to have impotence. I would expect them to have spinal degenerative disease. I would expect them to have cerebral vascular disease. I would expect them to have a problem with a cataract, quite often even had cataract surgery by that time. Most of the demented patients I've seen have had bilateral cataract surgery. Okay, so what I'm saying is they all get the same diseases. It's the same stuff all day long, every day. I expect the thoracic aortic arch to be all calcified, the Wing-Kessel effect long gone, okay? So what I'm saying is it doesn't have to be that way. It's kind of one of the main points of this whole book. And that's why the vegan diet is so powerful. It's the most powerful thing in all of medicine. Okay, and here's just showing like what does the plant diet have going for it. You get more fiber, that protects your gut barrier, and that also protects your blood-brain barrier. You get more potassium, those are your vasodilators like we talked about. The magnesium vasodilator, more nitrates, that's NO3. Gets converted in your mouth to NO2, gets converted in your stomach to NO, systemic vasodilation. Sunshine also releases nitric oxide precursors from the subcutaneous region, okay? You get more antioxidants that helps protect you from oxidative stress and all those problems, helps your mitochondria to run better. So it's all good. Okay, now here's sort of like the great secret of hypertension is the fact that this is like what Moore was saying, you want 5 to 1, at least 5 to 1 potassium greater than sodium. And if you eat a plant diet, you'll easily get that. And then I'm going to tell you about the story about hypertension in black people, which is kind of interesting. I never count my potassium. I just eat the food and it takes care of itself. And you want to be simple. Like I said, live like Adam and Eve, but keep your indoor heating and plumbing, and you'll probably be pretty healthy. And when you avoid hypertension and atherosclerosis and diabetes, you also lower your risk of obesity, impotence, heart disease, and cancer. Okay, and I talked earlier about how you got to maintain the amounts of your cations to not have cell swelling and osmolality problems. Okay. Yeah, like I was saying, when a person eats too much sodium, they piss out their potassium, and this messes up their plasma membrane gradients, and then they can't pump calcium out of the cell so well. And if you have too much calcium in the cytoplasm of your vascular smooth muscle cells, they stay contracted, and you will be hypertensive. Okay, so it's vasoconstriction. You can think of potassium and sodium as like minimum wage workers working their tails off all day long, and calcium's like the aristocrat. It comes in and just bosses people around, and it controls the cell. It tells the cell, okay, calcium's in high concentration in the cytoplasm, cell will be, the vascular smooth muscle cells lining your arteries will be contracted, and that vasoconstriction from them being contracted will cause hypertension. Okay. Okay, here's a little more detail on how a cell works. As a matter of fact, maybe we're about ready to call this. Yeah, I think we'll call this for now. So that's going to be the end of chapter 10b, and I'll start up in chapter 10c with this slide here.